Post-op day 5 is a very important in-person appointment. We expect all of our patients to come in on post-op day 5 so that we can make sure that we properly evaluate you and take your post-op day 5 photos. For our out-of-town patients, you cannot leave before this day. If you leave before post-op day 5, it is considered leaving against medical advice. Here, our nurses will examine you as well as myself. We're going to make sure that everything looks good and you're doing well and you're healthy before you go home. We want you to tell us about your experience, what we did great, what we could work on. We really appreciate your feedback. Remember, here at Pure Plastic Surgery, we want to make sure that we're improving every single day. It's post-op day 5 and you've had your tummy tuck. So we're going to be checking primarily your drains. We want to make sure how much fluid is coming out. If any of the drains have had less than 25 cc's in 24 hours, we'll be able to remove that drain. For most patients, we can remove at least one drain on this visit, but it's very, very likely that you may have to go home with at least one of the drains. We're going to be checking your belly button. We're going to be giving you instructions on how to clean it. You want to place some hydrogen peroxide inside the belly button and then antibiotic ointment along the incision on the outside. And the hydrogen peroxide you will only be doing for the next 48 to 72 hours. We're also going to be making sure that your garments are well placed. We're going to give you all additional foams in case that is needed. This early on in your recovery, you're still not going to be walking straight. You're still going to feel a lot of tension in that belly area, so you're going to be walking a bit hunched over. And when you're sleeping, you still want to have 2 or 3 pillows behind your back and 1 or 2 underneath your knees. If you do go home with a drain, please don't worry. You don't necessarily need a doctor or a nurse to help you, just someone who's willing to help you. And our nurses here will walk them through how to remove the drain, which is a very, very simple 3-step procedure. Once both drains are out, then we'll be able to switch you from that binder into your faja. A tummy tuck does require massages, but there's a few important points. For the first 2 weeks, you should not be getting massages in the front belly area. Remember, you have a long incision there that needs to heal. We don't want to be manipulating that area. The massages are going to focus on the flanks and the waist, which is where we did the liposuction, and the lower back. The reason for massaging the lower back is because you're going to have some muscle spasms from the position that you have to be in after your tummy tuck. After 2 weeks, then you can have some light massage to the front belly area.